Yeah. Good afternoon, everybody. This is Dr. Duncan McCollum coming to you live from KSCO Santa Cruz. It's a beautiful day here. That song, You Can Be Free, by my good friend Steve Funderburg and sung by Tony Lindsay, 8-time Academy Award winner. Listen, this is a great show today. I have a very, very good friend of mine, Dr. Curtis Martin, on here. And he's a chiropractor. He's been in practice for 25 years. He has 3 really large practices over the hill. He's just saving so many people, helping, not only individual patients, but a lot of other chiropractors become more able to help the multitude. His mission statement is make the world a better place, and I'm very happy to have him here. Curtis, welcome to the show.
Thank you, Duncan. I really appreciate it, and it's my privilege to be on today. I'm excited to have this conversation to share with you some great things that I've seen in my practice, but also just the newest innovations that have happened in healthcare, which it's changing people's lives every single day. So I hope the listeners are not only to get some great tips today, what they can do for themselves, but also just to, again, understand how things are changing in the world of regenerative medicine, stem cells specifically. There's so many changes. So people that have been suffering, there's a lot of hope that's coming your way. So I'm excited to be on this show today.
Yeah, absolutely. So Dr. Martin and I both got our Softwave TRT machines back in 2019, I think within a month or 2 of each other. We were the first ones in California to have them. There were only 200 in the country at the time. Now there's about 600. But you, the radio audience out there, have heard me talk about the TRT machine many, many times, and I've had other friends on to talk about it. But what's really very cool about having Dr. Martin on the show is he has 3 clinics. He's done so many of these treatments in those clinics and learned so much. The thing about this Soundwave machine, I mean, it's simply sound that comes out at 3,358 miles an hour, goes through healthy tissue, but does something to the unhealthy tissue. We are learning every day new things that it's doing. We don't even know how far up is up yet. But Dr. Martin has, by having the clinics he has been able to put together treatment plans and understand the healing process quite a bit more. So I'm really glad to have him here so he can shed a little light on what he's found with these machines, people that he's helped, and techniques that we're utilizing across the country now to change people's lives.
Yeah, couldn't have said it better. I mean, it comes to the Softwave, and just to go backwards, just a little bit to give you a little bit of background before we enter into Softwave. And the first part is, when I was growing up, and we'll get into my story, which, wait till the end of this broadcast, and I'm going to share you my personal story that I think will be a little bit shocking to you about how I became a chiropractor. But it was a calling. But when we look at the therapies called Softwave, and it's a modality that in chiropractic, we use the innate ability of the body to heal itself, which means that we believe, and I hope all of you believe, that your body is an incredible healing organism. And a lot of times that if there's something that's not healing, it's purely because there's interference that your body just can't get through by itself. And in chiropractic, that's what we gently do. We gently remove nerve interference to allow the body to heal itself. And in that same, we call it releasing your body's innate potential, which means the inborn potential, which means the power that you were born with. There's also, now that functional medicine has been exploding, now we've learned something very, very unique, that actually cells in the body have their own innate intelligence. And so this sound wave truly works on the smallest unit in your body, the cells. And the sound wave, like Dr. McCollum just said, is so fast that when this is generated, that impulse, that's the part that I just get so excited. It actually tricks the body that it's under pressure. And by doing that naturally without pain, it's safe and effective, that it actually does like a 50% microinflammation, which is necessary for healing, but also it's a 50% reparative process. So it's kind of doing both at the same time. And that's what makes it so unique. And the reason why we're talking about this is a lot of patients, including myself, I got this machine, like you said, 3 years ago, because I had a bad injury. And the first time I've used it, Doc, the first time I had a 50% pain reduction. And I had a serious injury, a serious accident that put me in the hospital. I was in there for a week, got home, was moving a walker around the house. Some of you people that are listening, you're like, I can relate. I've been hurt. I've been limping around the house. It sounds like you. That was me. And I was looking for that, that one thing that might change where I was at. And because I just wanted to at all costs avoid, injections, surgery, regular prescription medication. And so that's when I found Soundwave. So that's my point. So what am I saying? 50% reduction of pain, first time. And I was like, I mean, it literally just like exploded my brain to go, I've used every type of modality, chiropractic. So when you think about that, like your first treatment, you're already feeling results. What? And that was it. So I'm excited to share you more details, but that's kind of how this got started and the units that we're working on. I know, Doc, maybe you can explain. We always say there's 3 things that are happening, and it'd be a great, and I know you know what's happening. You've used the machine for 3 years as well, but tell me,
Yeah, so that's great. That story is amazing, and I'll tell mine a little later, because it's from pain to purpose. Almost everybody in the healthcare profession, the natural healthcare profession, we know is pain to purpose. And we've been in several groups of many doctors that are always getting together going, how do we fix ourselves? Because we want to continue to help other people. And what's so amazing about the machine is, number one, it's going to go in, and that sound is going to locate the areas of injury or non-optimum functioning tissue, be it a knee, an ankle, a shoulder, low back. And there's some applications that we don't do because it's so new, but it goes in there and it disrupts the tissue. And as you were saying, telling the brain, oh, that looks like there's an injury here, although it's not an injury. There are some machines that actually cause injuries, and this is not that. So the brain goes down and figures out what's going on there and sends all of the helper cells and the stem cells and a lot of chemicals to the area to help heal it. And it's so if a blood vessel that goes through the area starts to expand, like if you slammed your finger in a car door, first thing that happens is it swells. That blood vessel starts to get holes in it so that chemicals can get out of the bloodstream into the damaged tissue along with the stem cells. And some chemicals that will actually take care of the pain emitting chemicals. So that's one reason we see the decrease in pain so rapidly. It also, again, brings your own stem cells that are lying dormant in your long bones into the area. And another really cool thing is it creates new blood vessel growth. So these little capillaries grow into the area. One of the things, I won't go to my whole story, but I couldn't lift my arm back then. And I'm, trying to adjust people. But what I understood it to do is where the muscles attached to the bone in my arm here, every time I injured it from 4th grade when I first tried to throw a ball too hard and tore the muscle, that healing process starts, and then the next emergency comes along. So the body doesn't have a chance to really heal it correctly. And that goes on and on and on. So rather than nice, healthy tissue, you have this mishmash of scar tissue that's not elastic anymore. And blood and nerves grow into that. So it becomes very painful. So over time, this becomes a chronic injury. And for me, what the machine did is it brought new life to that area, cleaned up the inflammation, the chronic inflammation, the stuff that had been there for so long. It actually starts to damage and break down the tissue. So those three things occur, and we just see, it's so fun to see the dramatic results. Chiropractic, when you and I got in practice, I've been in practice a little bit longer than you, but people would come in and we'd adjust them and they get well so quickly. We have 250 tons of toxins dumped into the planet every year, you know, and 114,000 chemicals dumped into the body since man started making chemicals.
Yeah.
So we need help, and this is one of the miracles that's come along.
Yeah. I remember, Doc, when you, and just to let you know, you actually got a Softwave machine prior to me, because I do remember having a talk with you, and you're like, I'm going to go try this machine on my shoulder, and by golly, if it helps my shoulder, I'm going to probably, you know, get one to help my patients. And you know, how's your shoulder doing now? We haven't even talked about it.
Yeah, it's doing great. I mean, you know, I was taking something down at a fair, and I reached over my head in a quick, tired after 3 days of working, and I felt my shoulder rip again. And it got to the point I couldn't even lift it away from the side of my body. It hurt so much. So to eat, I could lift it with my other arm, you know, but I couldn't eat with my left hand. The food kept hitting me in the cheek. So I had to learn to eat this way. And I went to Mexico. I had this stuff called PRP. We did everything. And at that time, our friend Dan Pompa's son jumped off a cliff and missed the water, 60-foot cliff, landed on his ankles, broke both ankles and 3 vertebrae in his back. This is right when this happened. And, you know, we were there. We watched Daniel Jr. go through this process. And within 4 weeks, he was walking.
Yeah.
In 6 weeks, he was on a backpack trip. And, you know, he's 20 years old. You know, I'm over that. But it was amazing. I had to drive for hours because I got a hold of Pampa, who introduced me to somebody. I had to drive for hours to find a machine. 40% improvement. The first day I could lift my arm up 40%.
Yeah.
I went back next week, it was 80%. I said, I'm buying it, because you know, it was so amazing for a chronic injury I'd had for so long.
Yeah. And that's the miracle. Like I say, I've tried every sort of, you know, we call them almost like biohacks, and it sounds like a rough word, but it means, you know, bio means, you know, more of a cell, and hacks means way to kind of get the body to manipulate it to get it to do what you really want it, because sometimes people don't want to wait for it to heal. And so that's what kind of stemmed into, I believe, the whole field of regenerative medicine. But basically a lot of people, Dave Osprey, you know, biohacks, things like that he's always looking for, you know, red light therapy, things to, you know, rejuvenate the body, to heal the body, to extend our life, we call it almost like extend our warranty. But out of all the different therapies I've ever tried, I've tried them all. Physical therapy, dunk me in a cold tank, hot saunas, you know, you name the type of therapy that they've advertised, I've tried every single one of them. And besides chiropractic, which really helped me over the years, and I've certainly helped thousands of people, this has been the next best thing. And it really is. It's not the docs, it's not you and me that help these people. It's truly the machine and the technology. And that's why it's been in Germany. You know, I was looking at this. We'll talk about, you know, I've kind of jumped in pretty deep with some of the research, and I was getting ready for today's show, and I was looking back at some of the research from Europe. And there's one doc, he's a cardiovascular surgeon. His name is Johann Holfeld, and he's out of Austria. He trained in Vienna. He was out of the Cell Signaling Center in Browns, in Houston, Texas, under another medical doctor. And he found that when he used shockwave, and he's been doing research on this Soundwave for 14 years prior to you and me getting it. It's been in Europe for a couple decades. And this is the part, for the first time that they've ever been able to document, it's so good at healing tissues, but the one thing it's been hard to do for all doctors is regenerate heart tissue after a heart attack. And it's been shown to regrow tissue, vessels, things that ordinarily, once it's been damaged, would never get better. And I was like, that is an absolute miracle. So that's why I said at the beginning of the show, I said, hold on, because no matter what you're suffering with, there's a chance as things progress, we're going to get these things, United States, get them FDA cleared and approved. I mean, this machine's already FDA cleared. I think it's already been FDA approved. I'd have to check the final date when it was stamped. But not to quote that number, but to say it's going to be so many more applications. And it's scratching the surface of really what it could do. But just for heart, I mean, talk about changing someone's life to get back their cardiovascular function, to start climbing those hills again, enjoying hiking with the family. I mean, that's what it's all about. That's about regaining back to why we were put on this planet, living the life that you're intended to live. And that's why I was excited to be on your show today, because some of you have never even heard about this. Like, what? What is this?
Yeah, you know, and what it is, it's a lithotripsy machine. Litho means stone and tripsy means breakage. And it was originally designed to break kidney stones, and it still is. And it had a very exact needle point target that it could be directed towards a kidney stone, and it would break it up, and then you could eliminate it. They put a broader beam on this thing, and it's creating miracles. You know, on this note, I think I want to play a short clip from one of my patients this week that came through, and we're seeing this.
Love it.
I'll tell you when, Dave, hold on one sec. Almost every week we see, several times a week, we see people that have the worst case scenario come in, and we see these remarkable results. So I have on the screen that you won't be able to see on the radio, but a normal lumbar spine on the left. In the middle, you'll see the lumbar spine, which is a low back and tailbone, with 2-inch screws going into 3 segments, and with a steel plate in back. And then in between where the shock absorber discs go, they have these steel screws in there to help this woman. And so it didn't work.
Wow.
And what I want to do is I'm going to go ahead, and Dave, if you can cue up that Karen thing, that'd be great. Yeah, go ahead. Okay, well, pretty remarkable results. And is what's really interesting. Are you with me, Doc?
Yeah, that's I was just listening to that going, that's why I love going to the office. I mean,
Yeah.
great job. I mean, great job that you're able to help her, and it's knowing that, you know, you have to have some skill knowing where to put it. But when I hear that, it just warms my heart. It reminds me of why I just love being in practice. Not so much just the blessing you gave to that person, but
Yeah.
just to be, as a doctor, to be witness of people, and it sounds like everybody would agree with me, getting your life back. Like, doesn't that
Yeah.
sound like getting your life back? Amazing.
Yeah. You know, what's really even more on this story is when she came in, she had this such low back pain. Now they actually that she had steel in her low back and steel in her neck, two discs in her neck. So she was in so much pain, they decided to open up her thoracic spine and put these muscle stimulators in her thoracic spine, which is her mid back, which had no problem. That it didn't
Wow.
work, and it created so much problem she couldn't even take a breath. When she walked in the first time, and I have another video I sent you earlier, but
Yep.
you look at the two pictures of her, and it's just remarkable. I talked to her last night because I wanted to make sure it was okay for me to play this. And, I called and I asked how she's doing. She goes, something really strange just happened after my treatment yesterday. And I'm kind of holding my breath, going, okay, what now? Because their
Right.
bodies are amazing, right? She goes, I left your office and I went next door to get a pedicure. She goes, now you got to realize I have not felt my feet in 20 years. I always had to be aware of where I was putting my feet. I had no feeling at all in them. When I cut my toenails or tried to, I just hoped I didn't cut myself. So she goes, I sat down in the pedicure chair, and the lady tried to start working on me, and it tickled and bothered me, and I couldn't do it. I couldn't handle the sensation of her
Yeah.
touching my feet, which were dead for 20 years. And I kind of sat there,
Wow.
waited. She goes, I'm so excited, I can feel my feet again. And I said, well, the nerves are regenerating. They've been dead for
Yeah.
so long. One more point. The reason she even came in is because the pain has been so bad with her. She went to the doctor, and they told her, well, the problem is in your sacral iliac joints. And our next surgery, which she had planned to do six weeks from last week, we're going to go in and staple the sacrum and ilium together. So we'll just go in, and she goes, and they just say they put a clamp, kind of like a staple, to staple my sacrum to my iliums. And she goes,
Wow.
I just didn't really think I wanted another surgery. So I thought I might as well give this a try. And,
Yeah.
so it's the funny thing is, Dr. Martin, is because I've been talking about this for so long, we get people that had no hope coming in. So many, it's just unbelievable. It's not, I mean, sure, the athletes with the knee problems and hip problems, family members, guys that sit or drive or, what have you, but we're getting these people that have basically given up hope to try to come in. Now, does it work every time? That's debatable on what happens on a microscopic level. And sometimes people aren't patient enough to do it. But
Yeah.
what are you seeing in your office?
You say such a true statement is that you were this lady's last resort. I
Yeah,
understand that. Like, this was her last before. I just look at that, the joints in the body weren't intended to be all pinned together. So, I mean, you don't want to make her into the Tin Man, where it's like, I just can't even imagine pinning the joints in the back, so your hips don't even, are able to flex. It doesn't even make any sense to me. But nevertheless, not to criticize, but me and my wife had this conversation. She was a registered nurse. She's also a doctor of chiropractic. And we had this conversation to say, how many times are we people's last resort? And you know this, how many times do people say to me after they go through a miracle like that? And it truly is. I'm going to tell you right off, you created a miracle in that lady's life. They go, I should have came here first. Right? How many times do we hear that? I wish I would have came here first before I did this other stuff. And, you just have to look at the statistics. I was putting a presentation together, and, I said, well, if the best surgeons, and I read a paper that was out of Ohio that they wrote that into the program to say, if before you fuse your lower back, try conservative measures for 6 months to a year. The least invasive, the safest, the most effective, and that's what Softwave is, right? And so on the formula of healthcare, they're actually telling the patients to go try 6 months to a year of conservative measures, and chiropractic is within that, and so is Softwave. But it's the doctors, I think, kind of jump out of turn and say, you know what, let me just, I do all I do is fusion, so let me just jump in and fuse you. And they kind of like, and they talk to, I don't know if they talk the patients in. I think it's kind of 50-50. Patients want to be fixed overnight. I think doctors do what they do best, and if they're normally surgeons, I think that's where they jump in. But I hope when you hear that story, some of your listeners, you're like, oh, I got a surgery coming in. You just have to do a little bit of research and say, you know what, try conservative measures for 6 months to a year. And of course, if they fail, there's always surgery. But I was amazed at some of the failed surgery percentages. You don't have to look too far to find a lot of rotator cuff surgeries. 40 to 94% of them have to be redone. That was on Purdue University. Then also with knee surgeries, 1/3 of people have chronic pain after replacement, and 1/5 it fails. So there's always a time and place for medicine. And I think when you're in extreme pain, I think that's before your body goes into shock. I think it's a good idea to make sure that you have some self-preservation by taking medicine. But I think most people agree, it's like, if there's an opportunity, if there's a chance that all of a sudden your life and your quality of life, doing the things you love to do, could be improved, with what, Doc? How long did it take to do that treatment on that young lady?
10 minutes.
10 minutes out of their life?
Yeah.
Yeah.
And we do, and I believe you do this too, because nobody knows about this machine. We just offer a $49 special, which everybody out here and knows who listens to me, because, and with that, we'll do a thorough consultation, find out when this started. Like for me, my shoulder was 4th grade. How many times do people dig to find out when this thing began? Oftentimes they go, I woke up and my neck is sore. It must be my pillow. Right. Well, you've had the pillow for, 5 years. Why today? But, it's so important to really find out what's going on. Then we'll take an X-ray, if appropriate, and usually it is, of the area we're going to treat. I can tell you how many people come in and say, I need to get my knee replaced. The doctor says it's bone on bone. I hold my breath, because literally the number of times I take X-rays and it's not bone on bone, I don't know what they're looking at. They must have a different definition than me. But we go ahead and, we do the TRT and we get results. Sometimes it's miraculous, or like this. Sometimes it takes a little while. The main thing to realize is, though, once you get it fixed, you got to maintain it. And I think with chiropractic and the stem cell machine, people, they haven't really been taught how to maintain the body in general. That's why they go to surgeons, and surgery's there when you need it. I had my appendix rupture. I had to go to surgery. I would have been dead if I didn't.
Time and place for medicine, for sure. And it's great that you do that. And I do a similar thing to the public, because, and I think we're very similar, is that years ago we have very successful offices. So it's not like we need to generate more new patients or anything to do with, progressing the practice as far as more new patients. I think I had a calling years ago, and it just resonated with me. And it was from one of Dr. McCollum's and my mentors that said, I care more about helping people than I do about the money. And for people that just want to try it and don't want the obstacle of money in the way, I think, that's why, doing an introductory special just to see if it helps you, I think is such a nice thing to do, because rather than all of a sudden being talked into, a program of care that a lot of patients have never even tried. That's the part about this, is you get to try it first. And if it helps you and we see the benefits, and we do our due diligence to check your background and history and exam and x-rays, then we say, yes, you're a great avatar for this device, and we can expect some good results. And hopefully, Doc, I can share a couple things that if you can't get to using a Softwave machine and you're suffering, because everyone either has had an ailment or knows somebody that's suffering, and you're like, okay, so if you have a pen and paper, go get your pen and paper, because I want you to write down a few notes, because this will definitely help you. I don't care what you're suffering with, whether even you got out of surgery and you're laying in bed, you're recovering from surgery, you can do these tips. So if it's okay, Doc, I'd like to share just some great things. So one of the things is the body works from oxygen and blood. And we know this machine brings in blood flow, but if you're at home and you want to improve the oxygen to your healing body. So if you feel at all pain anywhere or stress, we talked, Doc was talking about why are people, suffering so much. I think it's stress. Actually, we know what stress, right? How many people are under stress emotionally, worried about money, worried about family unit, worried about your kids, worried about your job. There's a lot of worries. And then there's chemical worries that you go onto Google, and 50% of people have a prescription medication that's a necessity of taking. So there's a lot of stress in our body. So if you're feeling stressed, you're feeling pain, lay on your back, bend your knees a little bit, make sure it's comfortable. Breathe in through the nose. We can all do this. We'll do this. And you're going to breathe like this for 5 minutes, and you're going to breathe in through the nose, trying to fill your belly. 2 seconds in. 4 seconds out. Do that breathing for 5 minutes before you go to sleep, and that extra oxygen will help those cells heal. You'll get a better sleep. And believe it or not, sleeping is the most important thing you can do, because sleeping will put your body into a nice reparative state. We call that in medicine called the parasympathetic state, which is the relaxation state of your body that is a necessity for healing. So if I get people to breathe, I get people to do that oxygen technique before they go to sleep, great improvements. The second thing you want to write down is how many ounces of water you want to drink. People always want to know that. They either drink what they should, half as much, or they don't drink it at all. They think tea or coffee or soda is that. So here's the formula, everybody. Take your body weight. I'm a 200-pound man. Divide that in half, and that's how many ounces of water you should be drinking. So I should be drinking 100 ounces of water per day. These cells, when you get that Softwave, the cell hydration is critical for getting a good result. So if you're planning to come in to get Softwave, do these things even before. Okay, very important. There's other tips.
Jump in for a sec. So that's 8 ounces in a glass of water. For those of you that are hard with that's a big number. So you're drinking, 12 glasses of water normally, and then, well, what is it? It's about 14 glasses of water. Can't do the math, but do it yourself. It's 8 divided by 8, or a pint.
Yeah. And so, but it's important. Most people are dehydrated, and it challenges your system. Good, clean water. I'm drinking water right now in my Yeti cup to keep it cool. It's just important. I'll give you 3 other tips, but that'll help you down the road of recovery, no matter what you're dealing with. The other part is I always stay away from sugars, alcohol, right? And processed food. Those are very important things to do as far as while your body's in a reparative state. Just trust me on this. I mean, obviously, I'm trying to give you the best tips on a short program. We could talk for 8 to 12 hours easily. And the last tip I'll tell you is making sure, and I'm sure you talked about this. Have you talked, doctor, about bad oils, good oils?
Yes, I have. But go for it.
Yep. 3 oils that I just say: olive oil, organic coconut oil, and avocado oil. Those 3 oils are good. A lot of the canola oils, a lot of the different seed oils cause a lot of different interstitial irritation. and inflammation that shouldn't be there. So I wanted to give you just a couple tips that you can do today, or people that you know or love can do today, and all of a sudden the next day you do the hydration, you do the good sleep, and you avoid those things. By golly, you'll wake up and go, I'm 10% better. Maybe it won't fix everything, but it's about helping yourself, which I'm a big advocate, because, you know, I know Dr. McCollum is as well. I mean, the body has such a miracle of different things it can do for itself. A lot of times we just had to get out of the way, to be honest, right, Doc?
It's true. And the inflammation that caused by those bad oils, you know, they actually cause inflammation at a cellular level, which is going to, it's going to sabotage so much of your health in your life. The last one that you know, usually mention too is a positive mental attitude. You know, start hanging out or take a look at what is in your life is stressing you out or making you unhappy. You know, a friend of mine was looking at stuff the other day on Facebook and telling me about some of these things going around the country that aren't that good. And I said, oh, what are the fun things that you've been looking at? And it, you know, she kind of looked at me and I go, no, you know, it's like they create bad chemicals in your body. When you take a look at movies, they've done studies this at New York Institute of Medicine, where they have people watch war movies and this and that. And they would take the blood and look for the repair enzymes in the body, and they were low. Then when they have the same people watch, you know, flowers growing and puppies and stuff, those repair enzymes are high because of the stress level that you mentioned. You know, we're talking about the bad stress, the, you know, fight or flight thing that comes on. So those are so important. And, you know, one of the other things is, I mean, this machine, I don't want to get off the topic of the stem cell machine because of, you know, just how amazing it is. But, you know, coupled with chiropractic, maybe you can talk about chiropractic works at one level and the stem cells work at another. And some people often ask, well, is my joint going to get big again? Is that disc going to come back? Maybe, you know, that's a question people just, they're not sure about.
Yeah, and I think that's a great question. And every single patient is different, and that's why, you know, the to sit down with somebody in every situation to diagnose what we can expectations is one thing, and sometimes we can fully expect a resolution of people's problems. Other times we can expect a 50%. So I think that special visit is so important because it sets up a prognosis of what we can expect and expectations. But you know, if you look at the Softwave machine, you know, we just talked about some healing guidelines to help you along. But if you look at the machine itself, that it really works under the microscopic level rather than, I call it the macroscopic. So chiropractic, you know, is designed to find where the body is interfered with in a human frame. We make an adjustment, it removes that interference so the body can communicate from the brain down the spinal cord through the nerve roots to every cell, tissue, and organ. So it keeps this communication going. And I think the Softwave, and so that from a chiropractic standpoint, I've seen big changes with alignment with humans frame, you know, and if we will, the common person with poor posture usually comes in bent over like this lady, and we help restore back to normal posture, normal motion, normal alignment, which helps the body function better, which, you know, that's what we're talking about. But the Softwave machine, it works on a very microscopic level. And so it's really working on, you talked about early, Doc, about bone on bone. And when a doctor says that, I always try to explain, they say all the cartilage is gone and the bones are not touching, but on the end of some of the long bones, they have painted on, that's what I call it, like painted on, that's your cartilage that's painted on the bottom of them. And as things age, that paint goes away. And then they say, okay, well, you no longer have cartilage that's painted on the bones. So the bone is facing the bone, and that's what they call bone on bone. Well, this machine, like we talked about, does those three things: the blood flow, recycles old damaged cells, and activates your stem cells. And the stem cell can become any cell. So it can become cartilage, ligament, muscle, tendon, bone, you name it. And that's the part that is the miracle, but it's going to help regenerate that necessary tissue that the body is craving for a repair. So the point is that at the very end, we know that the function will come back because the body's going to get the cells, but it's not going to be big enough that's going to be recognizable on a radiograph, because a recognizable radiograph might say, well, it's still the bone, but it can't see that new layer of cartilage being grown. So what we see as an end result, we're not interested in the post x-ray. We're more interested into the post patient that's feeling great, that's able to hike that hill, get up out of a chair, and basically we call it functional restoration. And it's something you can see them more comfortable, and you can see the range of motion. You can see them getting out of the chair. It's very obvious that you don't need an x-ray to prove that it works. You can see it. And we can talk about I'd love to talk about some stories I've seen that, like I've seen so many of them. Just we get to be witness, and I can tell hundreds of thousands of Softwave stories or TRT. This stem cell machine just works so well. It's amazing.
Yeah, one thing I heard you say the other day too, which I really loved, was, when you're healthy and cruising around in life, somebody could have 1,000 goals or 1,000 thoughts of where they want to go. And when you're sick or in pain, you have one goal, and that's to get well. How many people we're the most unhealthy country in the industrialized world. We're only 4% of the population. We take 50% of all the drugs. How many people are out there? How many of you listeners are out there just wishing you could get well? Maybe the TRT is the thing that could help you, or it might be more nutritional or other type of things. But, just having the hope and the idea, the glimmer of hope that something can change is huge. And your body's a miracle. It can overcome anything, I believe.
Yeah.
I want to take a quick break. We're going to listen to another patient of mine named Gayleen. She also walked in after 20 years of back surgery, and then we'll listen to her, and then Doc, please tell us a couple of your stories. We'd love to hear it. All right, here we go.
Are we going to play just Gayleen or Lauren too?
That's it. Just Gayleen.
I'm going to go right to you. No music?
No, yeah, that's fine. Okay, thank you, Gayleen. And now her whole family comes in. It's just remarkable. So you can call my office, 831-459-9990, if you want to try the $49 special. We can also find, we have docs all over the country now, friends of ours, basically, that have this machine, because we're spreading the word as much as we can. A lot of people it's so hard for people to change, but the innovators, the early adopters, like Dr. Martin and myself, we have just seen so many things. So we've got about 10 minutes left. Doc, why don't you kind of run us through a few things that you want to say, and we'll go from there.
Yeah. Well, I like I say, I really appreciate it. Oh,
there you go.
Yeah.
Got it. Yeah.
So there we go. I just wanted to make sure that I just thank you again for being on the show. I hope a lot of listeners are like this new technology, and yeah, it's funny when you say innovator, like this is something new, and it seems like because we've been using it for 3 years, you know what I'm saying? So we've kind of, I would say, and even before that, decades in Germany, it's been tried and true. You know, for some of the listeners, I want all the research, and there's so much research that I actually, and I know you give them too, that when you come in for that first visit, you want research, we have a little link that they go to the softwavetrt.com, and there's like 86 papers that, you know, to talk about all the things it does. So it's interesting because it really is a proven technique. But that being said, I do want to share a couple stories that I always think that it's fun to be in practice. I know, you know, as I look at all the patients I've served for 25 years, I think the Softwave story that comes to mind is a gentleman named Max, and he came in and he was bent over like a caveman, you know, and obviously been through a lot of health challenges, had the full, just like we saw this picture, you guys, if you see this picture on, it's just all these screws and stuff. It looked like a construction scene there. It's just like, he had the same thing, and he was all bent over, and he was in his 70s. He worked for PG&E, and he said, Doc, the only thing I want to do is I'm not married. I just want to play golf with my boys, and I can barely walk, let alone I can't even think about being on the golf course. So we got him started with chiropractic care, and he was so excited to come in because every time we'd adjust him, he would, even with all this hardware, he was a nice, gentle, specific chiropractic treatment. No matter, you know, I had so many patients that, oh, I'm so bad you don't even want to start with me. You know, if you don't start, you will be, that will be an accurate statement. But he says, you know what, give it a try. Every time I got adjusted, it got better. But when we applied Softwave to that lower back, it was a game changer. It really helped heal and hold those tissues. And as he went through his plan of chiropractic, and that's the great thing about these, most of the Softwave plans are 6 to 10 weeks of treatments to really get all the benefit. Then you just have to maintain it with maintenance optimization. But he got to stand straight. So he literally caved in like a caveman, walked out straight. And I remember on his birthday is when he took his sons out. They took him golfing. And for the first time, he was able to play 9 holes. And I remember him walking in, and you couldn't get the smile off his face. Like, it was to spend that quality time again with his boys in something that he was an active man his whole life, meant everything to him. You know, it just was like, you know, he didn't cry, but I was like, I just look at that when it comes to family is why we're on this planet. Just enjoying those memories and putting that one more memory into the mosaic of your life. It just meant, I know I got to see that. I put myself in his shoes and say, how rewarding was that? So that was a Softwave. And the first time he jumped off, and he's kind of, I call him almost like a, because he was a real active, played sports. He was a lineman in PG&E, so he really beat up his body. But I call him Doc. He's almost like a Softwave, you know, junkie almost. He's like, yeah, could it work on this? Could it work on this? Because my shoulders aren't working good. My knees aren't working good. He goes, I want to try it everywhere. And I said, you know, you need a Softwave stem cell machine makeover. And I said, anyway, we tried one at a time. We keep on resolving, but he's just, you know, it's just been a great story. You know, another story is I had a gym coach that she was, her big toe didn't work. It basically, they said, well, you just don't have the nerve supply to your big toe. So she couldn't walk. She limped, and she walked almost like a club foot, like a duck foot, you know, so one foot flared out, and she had such a big callus on the inside of her foot because she didn't walk straight. So when she came in, obviously we did the chiropractic assessment. We did Softwave on her lower back and also on her toe. And the first, like you said, 10 minutes, she walked up. I remember her walking with her bare feet after she got off the table in the exam room and said, can I walk? And she walked through the whole clinic. And all she said was, oh my gosh, oh my gosh, oh my gosh, oh my gosh. And she goes, Dr. Martin, look at my toe. And I go, yeah. And she was able to move it. She was able to wiggle it. And I go, uh-huh. She goes, no. You don't understand. That toe hasn't done that for 10 years.
Yeah.
And she goes, and so anyway, her limp stopped. She got back in the gym, and it was just like, you know, It's about restoring function. And was it the Softwave signal in the lower back that opened up the nerves to the toe? Yeah. Was it the actual interference that we found down in the foot? Yeah. Did everything, did we do it all? Yeah, we found out wherever the interference was, we restored it. Those are two stories that, I could tell a lot of kid stories, a lot of other stories, because it's the Softwave is good for everybody. But those are the two that, kind of remind me about, you just said it in the very beginning, pain to purpose, having a pain and go into your purpose in life. Max's purpose was golfing with his sons. I know he's not on this planet forever, but before he goes and bees with the Lord, like, how important would it be to have those memories with your boys? You know what I'm saying?
Yeah.
I don't know. I can't stop smiling for him. Or go to the gym and having all the gymnasts look at you and go, "Oh, coach isn't limping anymore."
Yeah, what happened?
It's just fantastic. So Softwave device, super cool. And it reminds me just of why I became a chiropractor,
Yeah. We've got about 2 minutes left. Do you want to just kind of give us a rendition? Because chiropractic's where it's all about. This just helps us get a better thing done.
Yeah, it's the power that made the body, heals the body. It's as simple as that. This uses the same principles of that. And, as far as to tell you the story, because I promised you I'd tell my story real quickly. Chiropractic saved my dad from back surgery, when I was 5 or 6 years old. I remember, he went through that, got on chiropractic. I remember he hurt his back when I was about 15, and I helped him get to the hospital because we couldn't get to the chiropractor in time. So he had to go to the hospital because remember we talked about pain, right? Before your body goes into shock, you need to get pain, right? So he was getting some pain, medication to help him, and the ER helped him. And I remember I was in a cafeteria and I asked, and I remember sitting there, it was all quiet. There's no one else in the cafeteria. And I prayed to God. I said, I wish I was a chiropractor so I could help my dad. And of course, 10, 12 years later, after getting through high school and college, I was able to become a chiropractor. But it was always a calling for me that I just don't like to watch people suffer. It's a service mentality. It's something that I just look at. And so I hope that when you know someone like that's listening to this, either you are suffering or you know someone's suffering and you can help them, you're like, I listened to something pretty great. You got nothing to lose but to go try this machine. Call Dr. McCollum's office. It's in Santa Cruz. I'm in the East Bay in Concord, Pleasant Hill, and Brentwood. We'd be happy to find you someone. No matter, we got Softwave machines. We started in the first 50 machines in the country. 600 are now all over. And we're in contact with, I think, just about everybody. We got a strong community in the Softwave community. We can find you somebody. And when we find somebody, it might just change your life. And that's what it's all about.
Yeah. Well, Dr. Martin, thank you so much for being on the show. It was really fun. We'll have to do it again with some more stories. Anybody out there, write down a goal. Write down what you want to see or how you want to see your health change in the next 90 days. And if you live around us and we can help you, give us a call. McCollum Family Chiropractic in Capitola. Dr. Martin's in Concord, Walnut Creek, and what's the other one? Brentwood. And so go out and have a great day. We'll see you all after the 49er game.
Go Niners.
Go Niners.